Ma'am, I believe he is facing some issues.
Okay. Arundhati, can you start then by any chance?
Sure. So, good morning, one and all who is present in this meeting. Let me formally introduce Dr. Amresh Srivastava. He is the founder and director of Mansik Shakti Foundation India and is a globally recognized psychiatrist, educator, and researcher whose work over the past 4 decades has shaped contemporary thought on suicide prevention, early intervention, and mental health literacy. He was born in North India and he began his academic journey at KEM Hospital and the University of Mumbai, advancing to academic and clinical positions in the UK and Canada. He has also authored over 150 scholarly works, including peer reviewed articles, book chapters, and public focused texts like Mind Matters, Dard Ka Safar, and Kamyabiya. His 5 volume international reference series, Suicide from a Global Perspective, features over 250 global contributors and is considered a landmark in suicidology. With more than 500 lectures and symposia across continents and led interdisciplinary research in suicide, resilience, stigma, and early psychosis. His online education content has reached over 40,000 global learners. Dr. Amresh, it's our privilege to have you here for the session. Now over to you, sir, to continue with the session.
Hi, good morning, my dear friends from Shillong. It's wonderful to have this opportunity to talk to you and discuss an important issue which relates to your subject and my concern. Well, the issue is challenges of students in contemporary times. As you all may be knowing, it's not a news that students in India also suffer from number of mental health problems. Now, let's talk about a minute why we discuss about students. Well, we believe that students are a unique population, very unique population, not because they are the foundation of society for tomorrow, but there are other reasons why they are so important. And the first and the foremost is that they are in a age group when brain of everybody is going through a maturational process. So any event, abuse or trauma or anxiety or anything adverse working in the environment or in the family affects the brain growth and the brain cells adversely. Their neuroplasticity, that means ability to replicate and respond, becomes poorer. The second most important reason why we want to talk about students is that when you ask some of the patients when they become all right in the age group of 50 or 60, that when was your first symptom felt, the answer comes that 50% of major psychiatric disorders they take birth during the age of 14 and 17 years. Well, it is a point of concern that if we miss those symptoms in this age group, the prevention of mental disorders becomes impossible. And the third most important reason is they are developing their personality at the moment when they are in this age group. They are trying to understand many things about this world, framing their ideology and philosophy, who they are, developing their identity as male, female, etc., and also developing an attitude towards others. This is the age when they develop social skills, how to relate to people, how to recognize people around them, how to make friends, how to develop relationship, advantages, disadvantages, ability to adventure. These are the reasons biological, psychological, social, environmental, and cultural. These are the aspects related to a student in the age group of 14, 15 to 18, 19, 20. And that's the reason why we want to talk about students. In a country like ours, we have 22 crore students, 4 crores in the university and the rest in the schools who will join the universities in future, which is more than population of a country or any major state uh, in our country. So you can imagine the amount of work that we have to think and deliver. The research in this field is very poor. Not much information is available. Sociologists have done some work and they know the social context, but their mental health research is very poor, and has not been very helpful in designing programs to prevent mental health issues in students. So that is a challenge. When I started this work, I went around number of universities, talked to the vice chancellors and head of institutions, talked to the students and parents. I came to know that they all are aware about the problem, but they feel very helpless that there is no answer. They don't know how to respond to these challenges. And when you ask any doctor, maybe a family physician or maybe even a physician or a psychiatrist, the answer is we don't know the specific response why uh, adolescents or early adulthood people develop problem and what can be done. The challenge in responding is that moment you design any program, it becomes impossible to implement because your time is so precious, hour to hour, days to days, and if any program demands extra time, the students don't have that time. The curriculum is hard pressing. Their thesis or their curriculum does not give them the liberty to change things and go for life skill development or a group therapy or sports or music, etc. So whatever program we design, it almost fails. It has not, so far there is no evidence that a particular program has been successful in students. So we believe that it is Naya Jamana, Naya Bharat. So the new answer will emerge only from students. We are only showing direction or working to the extent that we understand their problem. But how much it will be receptive, how much it will be effective, we don't know. Probably the final plan and implementation will come from students themselves. And that is why in our organization, our first belief was empowerment of students. What do I mean by empowerment? Is that let students identify their problem. They are wise enough to know that they are under stress, or they feel depressed, or they feel anxious. They are quite intelligent to identify this. But the denial or stigma of the problem is so huge that they do not go for any intervention. You know, in our country, 80% people do not have any access to mental health care, and those who have access to care do not utilize it. Call it unawareness, call it denial, or call it stigma, whatever name you want to give, but the consequence is that they remain untreated. An untreated illness or an untreated condition leads to a chronic phase which is not good for the candidate. Imagine if a depression is 10-year-old, people develop various symptoms, they don't feel like associating, their appetite goes down, they confine themselves to only homes, their work capacity becomes poorer, and so on and so forth. So, we believe that students can identify the problem. The next comes that once they identify the problem, if they overcome the barriers of care, as I mentioned just now, the stigma, awareness, etc., they will take a decision and possibly approach for treatment. This will give them opportunity for early intervention. This will give them opportunity to overrule parental judgment as well. In many families, when a student says, well, I'm not feeling well, I'm feeling tense, I don't want to go to school, etc., the parents say, you are talking nonsense, there is nothing like it, don't worry, continue, take rest, continue after that. There are some parents who do that, and it is very unfortunate. Then the students spend majority of their time in institutions. Now what happens in institution? How many stakeholders are there for a student's problem? The students, the teacher, the peers, and the family. 4 people. Out of 4, nobody has any idea what is mental health and mental health issue. It is because this subject has not been taught. To expect that somebody will know about mental health is really not very practical because we don't teach that. I mean, you know physics, chemistry, management because you are taught that. Nobody is born with this kind of knowledge. It is a body of knowledge which has to be administered amongst children. We believe that lessons of mental health must be written on first 2 pages of every textbook. It is only then our students will know what is depression, what is anxiety, what is stress, and why suicide takes place. With the reference of suicide, let me tell you how many people kill themselves in this country. More than 13,000 students die due to suicide every year. And 10 times of this number, more than 1.5 lakh, attempt suicide. And they are treated in various hospitals, brought back in the mainstream, but nothing changes in their institution. They are expected to perform in the same way as anybody else. The institution has no sensitivity for such people who suffer from mental health problems. The curriculum doesn't change, the examination style doesn't change, the behavior of teacher doesn't change, and in fact, many people are judgmental about the issue. So there is shame, guilt, stigma, despair, and disappointment. That's the situation about student suicide. So as I was talking that we believe that empowering student with decision making, once you can identify, you should be able to take decision. But how will you take decision if you don't know what are the options? So that's one part of it. Secondly, exams, the people who die due to suicide in student period, that is 13,000, only 30% of them died due to exam failure. Rest of them have very different causes. Maybe it is a family cause, maybe it is a cause of a mental disorder or anything else which remains uninvestigated. I tell you, there is one publication which talked about attempted suicide, and when the person was all right after treatment, the psychologist asked, tell me how you could have been saved. And the answer was, if my family would have talked to me, I would not have attempted suicide. This is a statement I'm making from a published literature. Secondly, the issue of mental disorder and substance abuse is huge. It's pushed and hidden under the carpet. Nobody identifies, and victim is the student. I'll again quote a research in our country in eastern part, northeast part of our country. They did the survey in high school boys and came out with the conclusion 50% high school boys were having drug addiction problem, stimulants, sleeping pills, alcohol, heroin, and many problem, number of substances. These are matter of concern. These are matters of health. You know, when I talk about brain development, education and mental health, the confluence is the brain. Your brain allows you to learn, to learn, remember, reproduce, think, have foresight, have insight, reproduce, and do everything you want to do for your success. And the same brain and same regions, that is the midbrain, middle part of the brain, is responsible for managing your emotion, your memory, your behavior, and your mood. So the brain development is so crucial for academic work that one must think about healthy brain, healthy life. And I say again that if anything stands between you and your success, it is only mental health. You may be intelligent, you may be in best of the best universities, and you may have best of the best faculties. You will not succeed if your concentration is not good, if your focus is not good, and if your mood is not consistent, and you don't know how to manage time. These are the issues of psychology, normal psychology, not abnormal psychology. There are two types of function that our psyche has. One is the basic psychological function like our memory, mood, sleeping, etc. And the other is little bit higher function, we call it psychological virtues. For example, gratitude, ability to trust, faith, hope, optimism, resilience, contentment. These are the characteristics which make you perfect or good human being. They are psychological functions. So where is the mind? The seat of mind is the brain. So I again come back to brain. That brain development is extremely important, and that is taking place from year after birth. You see, when human beings are born, they are born with 85% maturity of the brain. But the rest 15% is very slow process up to the age of 20-25. So during pregnancy for a mother, the brain development is taking place. So if there are problems in maternal life, in pregnancy, it affects the child. And after that, if there is problem in the development, that mother-child bond is poor, the human being's bond is poor with another human being. You see, the nutrition for the brain is environmental stimulation. You are more thinking, more close skin to skin for a child, your brain grows better. So these are the issues why students are important, and we believe what should be done because we don't know why they have problem and what should be done. So we said empowerment is important, your ability to take decision is important, and after you take decision, implementation is equally important, and possibly the answer, real answer, is likely to come from student. I am sure if ever you develop debate in your class or you sit in a group and start talking about it, newer ideas will emerge that how to deal with this situation. What makes me sad is to see the declining sensitivity of students towards their peers who develop mental health problem. So whenever there is a student who has attempted suicide or unfortunately died due to suicide, there is a roommate who suffers, becomes at a higher risk, but all others are mourning for few days, but it doesn't sensitize them to ask why my friend attempted suicide. What was it? Was it school? Was it college? What is the curriculum? Was it a mental disorder or any harassment or discrimination or any lack of physical means, family pressure? What was the problem? Maybe I am not accusing, I am showing a perspective that student to student bond needs to be strengthened. They need to feel and act for each other. Mr. A needs to speak for Mr. B, and Mr. B needs to speak for Mr. C. That's the kind of connection and holistic relationship which is likely to work, which is responsible for a good mental well-being. Without that, to expect that any policy would be implemented wherein everybody will participate, that's a theoretical option. It's not going to be possible in general. So now, having given you so much of background, I will talk about the experiment that we are doing. When I went around and realized that there is problem with the teachers, our group started thinking what best can be done. So, having decided that we need to empower students, there are two components: screening and identification, and providing care. For screening, the psychological tools, and some of you must be knowing, there are psychological scales, instruments which are developed and then they are they are tried in the field, they are validated, and this practice is going on for more than 50, 60 years in mental health. Everybody uses this. We thought of designing tests for our students with a proper Indian cultural thought. If you see the international scales, you will find directly testing for a diagnosis. For example, you will get that test for depression, test for stress, test for ADHD. Now that means you have diagnosed your problem or have identified the problem that I have depression, I will test for depression and nothing else. But we developed a philosophy that human beings need to be seen from multiple directions. We need to check their strength and we need to check their weaknesses. Globally, what is known as multi-dimensional assessment. And therefore, we developed 6 psychological tools. One, to measure stress. Second, any contemporary sign, warning sign for mental disorder or presence of any symptom. or mental health risk. Then we also measured the positivity and resilience and level of functioning. So this is a combination of testing the weakness, the problem, and testing the strength of an individual. It takes about 15-20 minutes to do the test. So test was developed, it was uploaded in electronic manner and tested on more than it was tested on 442 students in an engineering college. We found that the test was valid with high statistical value. We revised it and concretized it well, and then we developed a web app and mobile app. What you get ultimately after the test, after you do the test, the whole data passes through two level of criteria. One suggests what is the abnormality, and second suggests what do you need to do. Now these criteria are based upon international recommendation, Indian research, and experience of psychiatrists. So it gives you three options. One, what do you need to do to improve your mental health? Two, should you go and speak to a counselor? And third, should you go and speak to a psychiatrist? If anybody has a need to talk, he can dial Telemanus 14416, which is a national helpline. So when we developed this package, we enlarged it to connect with facilities where doctors, psychiatrists, etc. are available. We developed a program how they can see the students and how to record the data in electronic medical record, to the extent that when you are following up for a treatment and you feel some symptoms, you can write down and this will be transmitted to your doctor who can get connected with you. So this is the mobile app and web app we developed so far. So it is known as Relief. It is available from the website mansikshakti.com. It has come into Google recently, which is being revised, and it will be on iOS next week, I believe. After this was prepared, we did the research to try and see what is the difference in decision making of the app and decision making by a clinician. And we found that positive predictability is more than 90%. We are happy to report that this has been tried on more than 2,000 students and found valid. We are giving the program free of cost to all the universities in India. We approached the governors, the institution, the vice chancellors, and give them this program with one condition. The condition is that if they identify anybody who has problem, it is necessary to provide care to that person, and it is also necessary not to discriminate or be judgmental so that the student is isolated, remaining confidential. So the app gives an opportunity of high privacy, good data quality management, and confidentiality. You can do it anytime. It is economical. It can be taken, it is available for every corner in the country. So these are the issues which I talked, and this is the method how we thought we can one way or the other respond to the problem. There are many ways to respond to the problem, but this is a digital experiment, digital innovation is one way to respond to the problem. So we took a valid scientific method, applied as self-assessment, which is also having a lot of merit. It is scientifically validated. It gives you guided decision making. Valid options are available there whether to go and see a psychiatrist or to go and see a counselor or develop yourself by self development. The methods of self development is given in the website, very detailed, what you need to do, when you need to do. Every item has a PDF where you will find the text why you should do better in physical exercise, why should you do yoga, why should you do meditation. Of course, this generates questions, and we try to respond as much as possible. It is in English and Hindi so far, but we plan to develop it in other languages in future. It's taking time. The whole exercise is under an organization called Mansik Shakti Foundation, which is a non-governmental organization as a Section 8 company under Indian Companies Act 2013. We have a large group of psychiatrists, psychologists, social workers, academicians, and parents. So, dissemination of this innovative instrument that you can call or a software is the challenge. We know that from time to time policies are developed where implementation is required. For example, it can become a policy of the government of India to implement it in all institutions. We are already recognized by Ayushman Bharat Digital Mission. The integration with their system is going on, which will be over by end of this month. So it provides us huge reach out. But again, the question remains, how do we take it to the students in the universities so that they can be empowered? And that's why I asked the question. It is the issue of implementation of the program, and you guys are most suitable person for me to ask this question. What would you do to disseminate? How would you implement a program? What are the challenges in implementing the program, and what are the methods to win over these challenges? I think this is in brief that I wanted to say. I am quite happy to respond to any of your questions that you have, whether it is about students' challenges or answer to it, or with our experiment that we are doing. Thank you very much, my dear friends.